outdoors and socialize with other kids and understand his emotions and develop his personality. And I met him. He's what a bright, cute young man. But like so many parents, she's worried. She's worried about her job as a dental assistant and notching changes in what she has to do to make things work. She's noticing changes in Noah's behavior since he hasn't been in school since March. As a matter of fact, he said to the principal, "Where's my teacher? Can I stay here and play?" We were in his classroom. And she's had to learn or lean on her parents, which many, many people have to do to help her get through it. And it's really tough. But parents like Sarah in places like this center and the caregivers and educators who work here also give me a great deal of hope. You know, reinforcing my absolute determination that I've been pushing for over 2 years to triple the amount of money for Title I schools in those districts like this one, where every child in Title I district is able to have the benefits of an education at 3 and 4 years of age. That's why I couldn't think of a better place to talk about the third plank of my Build Back Better plan for the economy. This is about easing the squeeze on working families who are raising their kids and caring for aged loved ones at the same time, sometimes separately, but many times together. And it's about creating jobs with better pay and career pathways for caregivers and showing them that dignity and respect that they deserve. But I know it's hard. I know it's hard to think of a future when you're just trying to get through the crisis at hand. I know that the case of child care facilities across the nation is dire. People are looking for help desperately. And they've had to close their doors and lay off staff. And they're not getting the protective equipment they need to reopen. And the virus hotspots, where they exist, and they exist all over the nation, they can't reopen at all. And we're in a child care emergency. And it didn't have to be this way. That's why I'm calling on the President to get the facilities and the resources and the equipment that are needed and get them to them now. Enough. Each day, the pandemic death toll grows. Each day, in some states, more people test positive than the day before. And each day, too many American workers are still out of work and losing hope. It's been reported by the President's staff that the President is, quote, not really working this anymore. He doesn't want to be distracted by it. Doesn't want to be distracted by it. His own staff admits that Donald Trump fails the most important test of being an American president, the duty to care for you, for all of us. You know, it's also been reported that he'll block any funding for more testing and tracing in the next COVID relief bill, which is being discussed right now on the floor of the United States Congress. Just as states report record cases and hospitalizations and deaths continue to rise, this man simply doesn't understand. He can't deal with our economic crisis without serving and saving and solving the public health crisis. For all his bluster about his expertise on the economy, he's unable to explain how it will actually help working families hit the hardest. You know, he's quit on you, and he's quit on this country. But this election is not just about him. It's about us. It's about you. It's about what we'll do, what a president's supposed to do. The president's supposed to care, to lead, to take responsibility, to never give up. That's what presidents are supposed to do. Over the last 2 weeks, I've shared my agenda for economic recovery. I call it Build Back Better, because we can't just build back to the way things were before. We have to do it better. And the first plank of my Build Back Better plan rejects the defeatist view that automation and globalization mean we can't ensure American workers lead to a future made in America. Made in America. The second plank helps us outcompete the rest of the world and tackle climate change. I'll put millions of Americans to work in good union jobs, modernizing our infrastructure, while building a clean energy future, increasing jobs. Today, I'm outlining the third plank of my Build Back Better program, mobilizing a 21st century care and elderly childhood education workforce to deal with the caregiving crisis, and it's a crisis in this country. If we truly want to reward work in this country, we have to ease the financial burden of care that families are carrying. We have to elevate the compensation of those providing the care, the benefits and dignity of caregiving workers and early childhood educators. Even before the pandemic, millions of working families are faced with enormous financial and personal strains trying to raise their kids and care for their parents or loved ones who are living with disabilities. This is the so-called sandwich generation. Includes everyone from an 18-year-old daughter caring for a mom who suddenly gets sick to a 40-year-old dad raising his child and caring for his own aging parents. The joy and love are always there, but it's hard. I know it's hard. It's really, really hard. Families are squeezed emotionally and financially. They need help, but too often they can't afford it. And the professional caregivers out there, the home health care workers, child care workers, or more often women of color and immigrants, are too often underpaid, unseen, and undervalued. The pandemic hits and squeezes and tightens on everybody. Nursing homes have been hit hard. If you're a frontline worker,
School year, a lot of parents and their children of college-bound kids are extremely anxious about their child's inability to compete because the online education the state is providing is not giving grades that allow them to compete against students from other states or even from the parts of the state that are offering in-person education. Needless to say, even non-contact sports are being disallowed. And parents of special needs children throughout the state of California, and I've spoken to dozens of them over the last few days, will tell you that the state utterly failed in even trying in most districts to provide the specialized attention that their child with autism or other learning disabilities have. And this is tragic, and it is also a betrayal of the taxpayers and of the federal mandate to educate these children. So in a very short period of time, we have drawn together the science that underscores the importance of opening these schools. And I want to emphasize that the science comes from across the political perspectives and spectrums. Just yesterday in the Boston...
Think of expanded vital services like rides to appointments, meals, day programs for seniors, making their homes safer for them. It builds on an innovative and creative provision under the Affordable Care Act, the very program the president ceaselessly is trying to gut. For example, there's a pilot program now in 27 cities in 16 states where a nurse, an occupational therapist, and a handyman come to the home that's caring for an aging family member. They might not be able to cure mom's Alzheimer's, but they can make sure she doesn't break her hip. So they walk through the house. This is what's going on now. And they install handrails in the right spots in the house, in the bathroom. Or they fix the door that's stuck so she doesn't trip while she tries to open it. It initially found that about $3,000 in program costs yield more than $20,000 in saving to the government, from hospitalization to other reasons. Simple steps to save lives, save money, and provide critical peace of mind. Here's another example. Whether you live in rural North Carolina or central Philadelphia, people of color or economically distressed communities face punishing health disparities from a system of systemic discrimination. They don't have health insurance. They don't see a doctor. Sometimes language is a barrier. And they slip through the cracks, slip through the gaps, so their treatable condition, because they can't afford to go to the doctor, becomes a chronic condition. That's why community health workers are real heroes. They go into these communities. They make sure folks are getting the care they need. My plan puts to work 150,000 more of these workers in our communities throughout the country. These are the things we can do now. Secondly, we can also make high-quality child care affordable and accessible. My child care plan is straightforward. Straightforward. Every 3- and 4-year-old child will get access to free, high-quality preschool like students have here. And low and middle income families won't spend more than 7% of their income on child care for children under the age of 5. The most hard-pressed working families won't have to spend a dime. Here's how it works. They can either decide to get up to an $8,000 tax credit for child care. For a middle-class family with a couple of young kids spending $300 a week on child care, that means an annual savings of $8,000 in their pocket because it's a tax credit. It means everything for working families living paycheck to paycheck. Or the federal government would send funding to states, which then work with child care providers to cover the cost for working families with young children. Over 7% of their income would not have to be spent. So say both parents are working and need child care. You go to childcare.gov, which is created under the Obama-Biden administration to help fund child care that works for you. Under my plan, it takes you to your state website. Local child care centers pop up. You can call or fill in your information. You apply to which one you want to go to. The state then sends you a letter saying you're approved and lays out the amount you're going to pay. The state sends that information to the child care provider, and then the state reimburses the child care center on the back end. You just pay what you're supposed to pay. Not a dime for some working families, and no more than 7% for anyone else. You can do that. This would save families thousands of dollars, but more importantly, give them peace of mind. And there's other common sense steps we can take, like expanding tax credits for businesses to build child care facilities on site. So you can go to work with your child, put them in a child care center that the company got money for, a tax credit for building, supporting more and more and giving peace of mind to a family. And when you're finished work, take that child home. Supporting more aftercare, weekend and summer cares for programs for families. Third, we expand access to caregiving. We need to pay and support caregivers beyond what they are now. They're doing God's work, but home health workers aren't paid much. They have few benefits. 40% are still on SNAP or Medicaid. So my plan is direct. It gives caregivers and early childhood educators much needed raise. No one should have to work more than one job to make ends meet. Under my health care plan that defends and expands Obamacare, there will be more affordable health insurance. I'll make sure these workers have an effective way to unionize and collectively bargain and protect their rights and earn benefits. This plan will help workers, especially those without a college degree, help them gain new skills in good-paying industries like healthcare, and provides new pathways to advance their careers. For example, a home health care worker can have access to training needed to become an EMT, or a nurse, or physician's assistant, or even a doctor. Or the early childhood educator can receive coaching to keep delivering high-quality learning experience. We can do this. The bottom line is that a mobilized caregiving and early education workforce would save families time and money, get their loved ones the care and early childhood education they need, and put more people to work, allowing husbands and wives to go back to work and providing many people the opportunity to get a job that's a decent job, caring. It keeps seniors in their homes. It's a triple win if they choose that. It recognizes the realities facing modern families and provides them the much-needed economic support in the middle of a pandemic. Just imagine, if we can put 3 million Americans to work in new care